caller 6, you have to push *6 to unmute yourself.
Hi there, Catherine O'Leary.
Thank you.
All right, great. Thanks, everybody. Again, we are in record mode now. Thanks all for joining us. I think it was helpful for everybody to have that that break last Friday for spiritual and physical and mental reasons, but it's also great to have everybody back. So I'm going to start out just by giving a civilians update, if you will, on two things related to COVID-19. And I'm going to rely on my prop, which I no longer have, my mask. I must have recycled it. But first, to this group, and I know, as I said last night at the Selectmen's meeting, I'm probably preaching to the choir. But given that Governor Baker has confirmed that the Commonwealth of Massachusetts is unfortunately within a surge of COVID-19 cases, hospitalizations, and saddest of all, fatalities. Now more than ever, it's important for everybody to do the right thing, and that is to wear a mask or a face covering of some sort if you go outside of your home or regular place of comfort. If you think you may be coming into contact with anybody in any way, it's the right thing to do to wear a mask. Now, we know the mask is not for our own personal protection, but it's an act of kindness towards everybody else, and if we all do it, we're all protected. So I know in a moment, Megan's going to give you more specifics on that from a public health director, but as a resident and human being in the town of Harwich, I'm urging everybody to please ensure that when you go out in the public that you are utilizing masks or face coverings, which is the simplest and one of the most effective steps we can take to try to reduce or eliminate the transmission of COVID-19. The other thing I want to talk about is by now we have the town of Harwich has released guidance document number 11, and number 11 talks about the continuation of reduced operational capacity for the town of Harwich's government. Because we're in the surge, we're trying to take every measure to ensure that the general public and our employees remain as safe as possible. So we have greatly reduced our operational capacity for the second week. The changes to that are we are reopening the portions of the transfer station that were closed, and that's the bottom half that deals with yard waste, manure, construction, and debris. So that will be open effective Monday, April 20th. And the DPW is taking measures today and tomorrow, to affect social distancing and broadening their traffic schematic. The second item that may not pertain to folks in this group directly, but if you can help us spread the word, we are resuming inspectional services in the town of Harwich effective Tuesday, April 21st. And that would be in relation to any construction that was deemed by Governor Baker previously to have been essential. And it's my understanding that a lot of that gets to construction of homes and living spaces and things like that. Both of those resumptions are because those, both the transfer station and inspectional services are considered by the Commonwealth of Massachusetts to be essential and cannot be removed. And then lastly, as I've mentioned, and I will say this from a personal perspective, but I would say mercifully, we have a state recognized holiday on Monday, April 20th, and that's going to allow staff. Government buildings would normally be closed. They will be closed for this holiday. And that gives us all a chance on staff to take a much needed break. So town operations will not be normal operations on Monday. Rather, it'll be public safety and transfer station. So those are my updates. I'll now turn it over to the town of Harwich's public health director, Megan Eldridge, for a more detailed COVID-19 update. Megan?
Thanks, Joe. It's good to see everybody today. We have some new tools for use by the public by Cape Cod Healthcare has released a heat map, which you should be able to access through their website, the Cape Cod Commission's website, as well as the Barnstable County's website. It's a map that has Cape Cod cases town by town. Some instances they get down right to the zip code level, but that's a tool for the public to see where there may be hot spots or where things may be looking a little better on the Cape. That's a new tool they just released earlier this week, as well as the Department of Public Health. They have on their website every Wednesday, they're releasing town by town numbers of positive cases throughout the Commonwealth. So you're able to see numbers of positive cases, but they're also releasing other types of data, statistics on hospitalizations, which hospitals have what number of positive cases, our surge capacity for ICU beds throughout the state. And like Joe said, we are in the surge of the pandemic right now, and we're seeing that by the increase in the number of fatalities every day. Currently in the state, as of 4 o'clock yesterday, there were 32,181 cases in Massachusetts with 1,245 deaths, which translates to a 3.9% fatality rate. In Harwich, as I updated the selectmen last night, our numbers remain at 29 cases in Harwich with 1 fatality. And hopefully optimistic, we have not had a positive case in a week now. So it's a really good message to people that we are doing the right thing, and our public health tools are working, our social distancing, our closing of non-essential businesses, hand washing, using face masks when we're out in public, and hand sanitizer when you don't have access to a sink. So it's really great to see that what we're doing is making an impact. Barnstable County seems to be slowing in the number of cases per day, with 550 currently and 18 fatalities due to COVID-19. So that's also promising to see that our curve may be flattening in the county. But again, cautious that the Cape has been a week or two behind the rest of the state. So day by day, week by week, we'll see what the numbers do. But I just want to make sure everybody is maintaining the course. And even though we're seeing fewer numbers day by day, it's still really important to maintain that social distance, only going out for your essentials right now. Some new updates that the state has come up with over the last week. They've done a grocery store advisory. So you'll see lines on the floors of the grocery stores to have a visual of what 6 feet is between customers. They have also been mandated to reduce their occupancy down to 40%, which allows for fewer people in the store. Our grocery stores were the busiest places in town for obvious reasons, but we need to help people help themselves by limiting the number of people in the buildings. You may see some lines outside of the grocery store because they may have reached their occupancy. So just be patient and try to shop for more than a few days so you're not having to go out to the grocery store as often. Joe had mentioned masks, and at the very beginning of this pandemic, masks were at a premium, so we weren't asking people to wear them because they were taking away a very valuable resource of our first responders. We have plenty of masks now, and we want to alert the public of the ability to wear a cloth mask, a homemade mask. You can wear a handkerchief over your mouth and nose. And again, that's really to protect others because you may be carrying the virus and not know it. And that's a very real possibility right now. Most cases are asymptomatic. Is what they're finding when they do widespread testing. More people are coming up positive without knowing that they had it. So those people may be out in the grocery store, and that's why everybody needs to maintain social distancing and wear a face covering to protect other people. One other thing that has been updated on the state website, which we do have a link to on our own website, is the frequently asked questions in regards to non-essential businesses. There's a list of what is essential, and then there's frequently asked questions on, is this essential, is that essential? And there are some bullet points of that answer most of those frequently asked questions. We've had a lot of our landscapers essential, our construction workers essential, our tobacco shops essential, that sort of thing. So the frequently asked question link on the state website is very helpful if you're looking to find out if a business should be open or should not be open, and it refers complaints to the local Board of Health. So we've had a few of those and we've followed up with them, and we're able to continue to take it on those types of complaints. So if you see a business that's not supposed to be open or you don't think they're supposed to be open, feel free to give us a email or phone call and we'll follow up with that. Our website and the state's website are your best resources. Our website is going to be linking over to the state website for things like the Department of Public Health's daily situation report. If you're looking for one document a day as to what news the governor has come out with or what updates are most timely, that situation daily report is wonderful. It's 1 or 2 pages and it has lots of great information about what's going on in the state and new resources that are coming out for homeless populations or people that are in need of food, housing, where to get tests, that sort of thing. So all of these resources are linked from our website. And again, we're doing a great job right now, so keep it up and I'm happy to answer any questions.
Thanks, Megan. Appreciate that. Next, I'd just like to recognize Larry Ballantyne, Chairman of the Board of Selectmen. Larry, if you have any information you want to present.
Just briefly, I see that Senator Sears joined us and Pat Johnson. It's been a long time, Julian, since we talked. We need to quit meeting this frequently. It was last night. So thanks for your help. Just a comment on the emails I get that seem to be of most interest. And one is opening a landfill. We've gone through various variations of that where it was closed only except for trash, and then we canceled recycling. Through the work of Megan and Joe and Link and others, that was open recycling. Now, as you heard Joel say, we're now taking construction waste and grass clippings. The other question I get often are numbers available. Megan, you certainly have given us the sources and where those numbers are. And I think all of us, as much as we can get that out, people want to know that. I also get a fair number of calls wondering about when we can open the golf course. And we can figure out a way to keep, even have some emails saying those are critical for mental health. You can take that for what it is, but the point I want to make is the emails I get are very appreciative of how we're all working together between the state, county, and our town, and all of food pantry and the churches and the Chamber of Commerce, and people are very appreciative that we're doing that. We take that for granted, but it is not. So I want to throw my thanks out to everyone for making this happen. And Joel, that's what I have to say.
Thank you, Larry, and great input. Appreciate that. At this point, I'll just open it up to the entire group. If you have any questions of Megan, Larry, or myself, or if you have any updates or information you'd like to put out there. So we'll open it up to the group now. Remember, if you're on the phone, *6 to unmute. And if you're on your computer, you need to click on your microphone icon to unmute.
Sean, this is Chris Menard from the pantry.
Hey, Chris, go right ahead. Great to hear from you.
Yep, we are here, we are open, and we are accepting anybody who has any kind of struggles with food or hunger. So if anybody has any questions, please give us a call, but it's a very quick registration for new clients, basically name, address, and how many people in your family. And then you can get food. So, and then people can shop every 14 days. So just want to make sure everybody knows that we are open and that we are accepting new clients and that everyone across the Cape is, of course, welcome.
Thank you for that update, Chris. Really appreciate it. And again, thanks to you and your crew and the volunteers and everybody there at the Family Pantry. The work you do in normal times is great work. I know I'm shared by this sentiment that we believe you're doing God's work. So thank you so much for that.
Our pleasure.
I have a
Thanks.
question.
Anybody else?
I do, yeah.
Go ahead.
I'm Susan Hartman from Pilgrim Church in Harwichport, and I took my cue from you mentioning God's work. Anyway, I am interested in finding out from Chris if they need donations and volunteers.
I'm sorry, was that addressed to me?
Yes.
And I couldn't hear you completely, so if you could repeat the question.
Chris, I'm the pastor of Pilgrim Church in Harwichport, and I'm wondering, I've gotten questions, do you need donations and do you need volunteers?
Yes to both. The donations, all we're able to accept right now is financial. We're not accepting clothing or food, so any financial donations are certainly welcome. And yes, we are still looking for volunteers. What we ask people to do is go to our website and apply through the website. And then what we have is a pool of people that we have on hand. And as people have to step back at the pantry, then we call others into the fray. So anybody that's interested in volunteering should go to our website. There's a tab at the top that says volunteers, and then you follow the prompts and fill out the application. It's all done electronically, and then we will give you a call.
My other
Does that
question,
answer?
yes, that does. Yeah, that answers it. Yeah, because people are wondering how to be helpful in the congregation. You know, how can we help others? That kind of thing.
Yep, happy to have anyone. We're good. Just have them apply online and we're good to go. And of course, we'll always take your money. So happy for that too.
Yeah, we're all worried about that. One other question came up. I'm sorry I was late to this meeting. I have a staff meeting at 11 every week, so it's kind of a direct conflict. At our meeting, we talked a lot about summertime and different projections and stuff, and we're making the assumption that probably it will be months before we can begin to congregate, and I just want to check that out.
So Pastor Cardmel, I'll start with that and then hand it over to our public health director. But we're still operating under Governor Baker's orders, which are set to expire on Monday, May 4th. So we fully anticipate that before that expiration date, we'll have further direct guidance and directive from the Commonwealth as to how we see the month of May and perhaps the months of June and July as well. So we're currently under the orders that prohibit groups of more than 10 from congregating. And so that would be one of the first things we'd expect some guidance on. We did hear the governor yesterday, and he's scheduled to speak again today at 2:30, where he has talked about the use of masks if social distancing is not possible. So we would expect to hear before or by May 4th, and we'll take our guidance from that. For more in-depth, I'll turn it over to Megan.
So to reopen sort of society or taking back the steps that we've already done are based on a few things. One of them is the rise in the number of cases we have, the plateau and how long we're at it for not seeing more cases every day. And then again, how many new cases per day we see on the downslope. So ideally, we'll reassess in a couple of weeks to make sure we're out of the surge, and then talk about stepping back the social distancing, the gatherings, the non-essential businesses, that sort of thing. There are whole task forces dedicated to these decisions, so they won't be done locally initially. They'll be done federally, state, and then we'll talk about things on the local level. I believe the way it will happen is some of these non-essential businesses will be the first to be released. Something like an office building that has limited access to the public that can still affect social distancing would be one of the first things to be allowed, and then we'll expand from there. So best case scenario, we'll have more information the beginning of May, but I don't anticipate allowing gatherings to start for another month or so.
Pastor Carmel, you're on mute.
That's more optimistic than I thought. So, but yeah, that's exactly what I thought, but I just thought I'd check it out. Thank you.
Thank you. Anybody else for questions or information?
Megan, last night you gave us some interesting information regarding and guidance regarding the disposable gloves. You want to maybe give that same message here, because that was I guess another change.
It's not really a change. I think a lot of people believe gloves are protecting everything, and they really just protect your own hands. So I need people to understand that gloves don't prevent the virus from getting on the glove to then be spread around to your cell phone or your steering wheel or your keys. If you really feel strongly about wearing gloves, they should be used for a specific task and then taken off, and then your hands washed or sanitized after you take them off. Gloves, a lot of people, I see them wearing their gloves in their car, to the grocery store, on their cell phone. There's a few kind of cute videos on YouTube that have someone put their gloves on and then put paint on their hands as if that's the virus. And it's a good visual to show that everything you touch, you're spreading the virus around. And even touching your phone, and when you take the gloves off and you pick your phone up again, you've just spread the virus from your phone to your hand. And a lot of people don't use, I should say most people who aren't in the medical field won't be able to use gloves properly, because gloves are supposed to be used for specific medical reasons. And hand washing is your best defense here out in public. And not touching your face, using hand sanitizer is very much more effective than wearing gloves improperly. So if you know you're wearing your gloves properly, there's no prohibition to it, but I really feel that people that I see aren't using them properly, and then they get disposed of on the ground or in places that they shouldn't. So I recommend not wearing gloves and instead washing your hands before you touch anything that you're going to put near your face.
Thanks, Megan. Thanks, Larry. Reverend Arakawa, I believe you were going to weigh in. Please go right ahead.
Right. Thanks to everyone again for what you're doing in your respective communities. Wanted to thank Chris Menard because I happened to watch ABC local news Wednesday at 7, and the food pantry was highlighted.
Nice.
I'm sure she's aware of this, but it was just an outstanding presentation. And the basic message was that it was open to anyone who had needs. So shout out that it was a wonderful presentation. We can really be pleased with that. I just wanted to lift up, and I'm sure Susan would, that we're concerned that everyone's at home, and so they will put into practice spiritual practices and practices for exercise and good mental health. So if that means, getting out by oneself with a pet or not, and walking and praying or meditating, these are all things which will contribute, as Megan knows, to our wellness. And it's a time of testing for individual will in doing these things. But I know all of our faith communities are concerned about this and trying to reach out in a variety of ways. But it does also come down to individual commitment to practices that move us forward. So thanks to everyone whose picture I see here or names before us.
Thank you, Reverend. Anybody else who has information or questions or comments?
Joe, I can just chime in about Monomoy Schools and what's happening here. So we have launched into the current week with a slightly tweaked distance learning plan to try to make things a little more sane for families. We had a rotating schedule before that we put in place for a reason, but we're, I think, creating more angst that didn't need to be there. So we've launched a slight revision. We're still very proud that we are connecting with every one of our roughly 1,900 kids face-to-face every day. And our, I think the feedback that we've been getting from parents is that the distance learning is going well. In terms of making sure we get children fed, we continue to have grab and go available, so any child or any family can go and drive up to either the middle school here in Chatham or the high school in Harwich, and there is curbside pickup of breakfast and lunch every day from 9 o'clock to noon. We are averaging about 275 breakfasts and 275 lunches each day that have been picked up. At least as of yesterday, we have provided about almost 9,500 meals to families in the last 2.5 weeks. I'd like to just give a shout out and great thanks to the Harwich Community Center for last week providing a little holiday bonus since there wasn't the annual Easter egg hunt at the community center. They went and provided little special baskets or treats for families, and that really had the families come out. We had 644 families showed up to pick up meals last Thursday for Thursday, Friday, Saturday, and Sunday. We got lunch and breakfast for meals to families just from having that, let's say, little Easter Bunny treat. We will be serving grab-and-go meals on Tuesday, Wednesday, Thursday and Friday of next week. So next week is our April vacation. The admin team will be giving our cafeteria staff a break, and the admin team will be rolling up their sleeves and making lunches and breakfast for the families. But so we'll be closed on Patriots Day, but today families are picking up a meal and they're getting a meal for Friday, Saturday, Sunday, and Monday. So they're actually getting 4 meals for anybody that picks up today. Following April vacation, we are going to be starting what we call Sharks on Wheels. So we're a little concerned that, while the grab and go is going well, we're concerned that we have some families who may have needs but not have the ability to get here. So we have a form that they can just get to on our website and just request meals to get delivered to their houses. And we'll be heading out to homes on Mondays and on Thursdays. So on Mondays, we'll bring 3 breakfasts and 3 lunches for Monday, Tuesday, and Wednesday. And on Thursdays, we'll be bringing 4 lunches and 4 breakfasts for Thursday, Friday, Saturday, Sunday. So that will start on April 27th, and it'll be every Monday and Thursday. And families can just sign up on our website. And I want to emphasize that families don't need to have been on free and reduced lunch prior to this COVID-19 crisis. And we know a number of families are struggling because of the crisis. And, so the meals are available to whoever needs them. All they need to do is come by the Grab and Go each day from 9 to noon, or let us know, and we will have Sharks on Wheels get it to your homes.
Dr. Carpenter, some fantastic updates from you. Not the least of which what you just mentioned for food delivery and access to food throughout the school district. But also on the changes to distance learning, I can tell you that there are 2 Monomoy students that I am particularly fond of who responded very well to the changes. They have appreciated all the efforts. And so as a parent in the system, I please send to you to distribute amongst your staff our thanks for all the efforts of you, your administrative staff, and everybody, teachers, aides, and everyone in the Monomoy Regional School District for really keeping the exceptional level of education going for our town. So greatly appreciated. And I also want to go ahead, Scott.
Yeah, and I just it's an interesting time. It's a unique partnership that I think homes are forming with us during this, because I sent out a little email blast to our parents yesterday that began with a social media post that I saw from our community that that started something like day 1,000 of distance learning. Just like it seems like this has been a long time, and just kind of trying to set the stage for folks. This is probably how it's going to be for the rest of the school year, and I know it's challenging. I know it's we're all trying to do our jobs. I'm trying to do my job, while distance learning with is going on in the household. But I'm also greatly appreciative to the parents that have been stepping up and helping us with the learning that's going on. So it's been a great team effort from the school side, and we've got a great set of teachers and a great set of cafeteria staff that are helping. And I I'm also quite grateful for the families that we have and the support we're getting from them.
Thank you again, Doctor. I also want to build on what Scott was just mentioning with regard to meals, to inform this group, and then as is our hope with these community leadership forums, that you all go out and then speak to your groups, your congregations, your clients, whatever the case may be, for all of you here. But just when you look at it for a moment through the family pantry, through the Council on Aging Senior Dining Program, partnering with the Cape Cod Elder Affairs on Meals on Wheels and Monomoy School District. One of the things that we can say with pride and certainty right now is food is still available and still getting to the folks that need it, and to the tune of over 500 Harwich-based families itself, which is remarkable. I know Scott's efforts and the family pantry's efforts go beyond Harwich, but I just wanted to state for our audience that having more than 500 families, whether they are seniors or families with school-age children, still receiving this amount of food and food support is remarkable. So it remains a great story, and God willing, we can continue with that great story. So thank you, Scott. Anyone else who has anything to offer or any questions to ask at this time? All right, then I'll take that as my cue to thank everybody again. Enjoy the weekend. If you get to, enjoy the long weekend, and we'll meet again next Friday. Thanks, everybody. Stay well.
This